Hi, my name is Nicole Schuster and I'm going to be presenting to you our disease presentation. Mine I chose to do was coronavirus infection, which is also known as COVID-19. And I chose to do this because there's just a lot of stuff going on in the media right now, a lot of information that might have been misconstrued. I did do a lot of research on this, and you'll see mostly how it affects the respiratory system. So I'm gonna go ahead and turn my camera around so that you guys can see the slideshow that I created. And here we go. Okay, so coronavirus infection, also known as COVID-19. So first off, what is COVID-19? COVID-19 is a disease that is caused by the SARS-CoV-2 that can trigger what doctors call respiratory tract infection. It can affect your upper respiratory tract, which are your sinuses, your nose, and your throat, or your lower respiratory tract, which are your windpipe and your lungs. As you can see from my pictures, I put the upper respiratory tract and the lower respiratory tract just to kind of help people better understand. COVID-19 continued. COVID-19 spreads the same way all other coronaviruses do, mainly through person-to-person contact. Infections range from mild to deadly. This is why we have the social distancing going on and the masks and things like that, just to help keep us safe. And we're supposed to remain 6 feet apart from each other. Signs and symptoms of COVID-19. Now, these are just signs and symptoms that people have presented with at hospitals and clinics or wherever else, but everybody's signs and symptoms are different. These are just the general ones. People with COVID-19 have a wide range of symptoms reported. There were ranging from mild to severe. People with these symptoms or combinations of these symptoms may have COVID-19. The two main ones are cough, shortness of breath, or difficulty breathing. Or you could have two of the other following symptoms: fever, chills, reported shaking with chills, muscle, body aches, headaches, sore throat, new loss of taste or smell, nausea or vomiting, or diarrhea. Now, some of these signs and symptoms can also mimic the flu. So if you don't know what you have, I would just go home or go to the doctor, get tested, and then stay at home. The pathogen that causes COVID-19 is known as SARS-CoV-2. The SARS-CoV-2 was found to be a positive strand virus belonging to the genus beta coronavirus with a crown due to the presence of the spike glycoproteins on its envelope. In the picture, you can see the SARS-CoV-2 virus, or the SARS-CoV-2 pathogen, I'm sorry. So the round part here is the pathogen, and the little spikes around it are the crown on the envelope. So this little picture just kind of helps better understand what is going on. Pathogenesis. So the pathogenesis is basically how the virus affects the body and where it starts. So the virus propagates and mitigates down the respiratory tract along the conducting airways, and into a more robust immune response is triggered. Nasal swabs or sputum usually yield the virus. So here I attached a picture of your conduction system, and it just kind of tells you how the virus will work. So it will go into your nose, down into your conduction system, and all the way down into your lungs. COVID-19 is a new disease caused by the novel or new coronavirus that has not previously been seen in humans. In December of 2019, in Wuhan City, which is a province of China, became the center of the outbreak. The novel coronavirus disease, COVID-19, of unknown etiology, appears that an infected animal may have first transmitted this virus to a human at a food market. The diagnosis for this is a swab test in the most common method. It looks for signs of the virus in your upper respiratory tract. The person giving the test puts the swab in your nose and gets a sample from the back of your nose and throat. As you can see in this picture, you can see the person inserting the swab into the person's nose and tickling the back of their throat. The sample after that is then taken to the lab. They look for viral material. But and this could take up to 7 to 12 days. But some areas may have a rapid test that only takes 15 minutes. This next picture that you're about to see is what the swab looks like. I know, kind of scary, but it's not that bad. I've had the test myself. Treatment. There's no specific treatment for coronavirus. People who often get mild symptoms, they need to take care of their symptoms like rest, fluid, and fever control. Take over-the-counter medications for a sore throat, body aches, and fevers. And most importantly, stay home. Ways to prevent coronavirus or COVID-19 from spreading. Wash your hands. Wear a mask. My mask protects you, and your mask protects me. And only together we can save lives. So just wear your mask. Clean and disinfect. Please don't touch your face. And make sure that you are social distancing yourself from others.